Hello, my name is Kate Scudero, and I am happy to be joining St. Helena Unified as your new credentialed school nurse. I come to you with 15 years of school nursing experience. In addition, I've worked in acute care settings at both UC Davis and UC San Francisco Medical Centers, and I'm a family nurse practitioner. As you know, we are still in the midst of our COVID-19 pandemic. St. Helena Unified is going to continue with its multi-layered approach to keeping our staff and students safe. That approach includes masking, hand hygiene, ventilation, parent screeners, vaccination, and testing. In regards to masking, all staff and students will be wearing their masks when indoors. When they're outside, staff and students may remove their masks if they are comfortable. They can, of course, keep their masks on while outside, but while inside, everybody will be required to wear a mask. If for whatever reason, a student forgets their mask or their mask becomes no longer usable, we will have replacement masks on site. Students will be given the opportunity throughout the day to practice good hand hygiene. It will be modeled. They will have access to soap and water. They will have access to hand sanitizer. And in addition, will be given reminders throughout the day to practice good hand hygiene. They will also be reminded to try and keep their hands away from eyes, nose, and mouth, as those are vectors for virus spread. St. Helena Unified is very fortunate to have state-of-the-art ventilation in all of its indoor spaces. So we will be maintaining that and keeping students and staff safe on that level. The parent screener will take place at home. Each morning we will request that parents review the signs and symptoms of COVID in regard to their students' health. And if any one of the signs of COVID-19 are present, we request that you keep your student home and alert the school as to their status. That way we can determine next steps together. Vaccination is really our best safety for our students who are 12 years and older and all of our staff. We absolutely recommend and urge you to get vaccinated. And once you are vaccinated, please bring those records to your child's school so that we can have that on file in the event that we need to utilize that information in determining next steps in the hopefully unlikely event that there is a COVID exposure. We will have some limited testing on sites, and Mary Ellen will be introducing more information about that. Thank you so much, and I'm very excited to start this school year and seeing kids in classrooms very soon. Mary?
Thank you, Mrs. Scudero. As she stated, I'm Mary Ellen. I'm the Director of Curriculum Instruction for St. Helena Unified. I have been here a long time in St. Helena Unified, and I want to say I'm thrilled to have the students coming back full time. We're all so looking forward to it. As Ms. Scudero was stating before, the protocols we had in place last year will be the same protocols we have going into this year, except there's going to be a few changes as far as quarantine and isolation. So I'm going to go over those. Keep in mind, we will be sending home a flow chart, which really kind of breaks down exactly what I'm going to share today, knowing that the best defense is vaccination. If you are 12 years old or up, please get vaccinated, as well as the adults, and bring those cards in, as she was stating. So first and foremost, if you have positive COVID-19 with symptoms, you need to quarantine 10 days at home. You may come back after the symptoms have disappeared after the 10 days and you are fever-free without fever-reducing medication. You may come back to school. Number two, if you are positive COVID but without symptoms, you need to quarantine for 10 days, or you can get tested after the 5th day, and if it's negative, you can come back to school on the 7th day. So again, positive COVID with symptoms, without symptoms, You're expected to be home for 10 days. Unless you don't have symptoms, you can get tested after the 5th day, and negative tests should come back by the 7th day. You can come back to school. Number 3, if you have COVID-19 symptoms, there's 3 things that can happen. One is that you're going to be quarantined at home for 10 days, and then you can come back after the 10th day. If you don't have a fever, you no longer have any symptoms, and you are not using fever reducing medication, you can come back after the 10th day. Or if you have a doctor's note on file with us stating that there's an underlying chronic condition. So we will need that on file with us to state that these symptoms tend to be due to a chronic condition. And the last one is you may get tested. So if you go to get tested and you have a negative test, you can come back as soon as you receive that negative test. Again, that's when you don't have any symptoms and you have no fever and you're not taking fever reducing medication. Here's where the new wrinkle is for this year, is that if you are unvaccinated and you have close contact or you're exposed, but you are wearing your mask indoor when that exposure happened, and you're asymptomatic, you don't have any symptoms, you can continue to stay in school. But for that 10-day quarantine, you're going to be tested twice a week to make sure that we don't have any COVID going on in your body. So again, you're going to stay in school if you had your mask on, but you were exposed, but you're going to have to go through testing twice a week for the 10-day period. There will be a consent form that will be going home to allow us to do this. If there is not a consent form on file, unfortunately, we will have to send you home for 10 days. Now, unvaccinated close contact exposure, but you're not wearing your mask indoor, that's a no-no. Make sure you have your mask on indoors. But if you don't have your mask on indoors and you're unvaccinated and you've had exposure, if you're asymptomatic, you'll need to quarantine for 10 days no matter what. Or you can quarantine for 5 days, get the test, get that negative test, come back after the 7th day. You will need to continue to monitor yourself up till day 14. So again, it's the unvaccinated that we really want you to wear your mask indoors. And if you wear your mask indoors, you get to stay at school. Your parents will be happy, we'll be happy. We really want you to stay here. So keep your mask on indoors. If you're exposed, we will just start the testing. It's a simple test. We have rapid results. And that way we just monitor it for 10 days and we keep going with school. It's the unmasked, unvaccinated that will have a different protocol, as I just shared. Again, a flow chart will be coming home and this will explain it over and over because there's a lot of details. And I tend to get confused every once in a while when I keep reading it over and over and over. But I want you to know, we had a safe environment last year and we feel very confident we're going to have a safe environment this year. We have your sons, your daughters' best interests in mind. We want to keep school open. We want to be here first full day. It all requires us to do our part. And so we're asking you to definitely make sure your kids mask up when they come to school and they're indoors. Thank you very much. And we thoroughly look forward to seeing you next Wednesday for the start of school. Yay. Thank you very much. Have a nice day.